So I got my high ankle sprain when I was playing football. I was blocking, and as the running back was getting tackled behind me, the defensive player fell into the back of my ankle and bent it.
Okay, what we have right here on the right ankle is what they call a high ankle sprain, or also known as a syndesmosis sprain. They're very rare in the fact of they're not as common as a inversion ankle sprain, or even our external or eversion ankle sprain. But what happens is, with our anatomy that we have our fibula right here, our outside ankle bone, and then we have our tibia, or also known as our shin bone, and our medial ankle bone. So the anatomy that we have connected with that for our ligaments is we have our anterior inferior tibiofibular ligament, and then we have our posterior inferior tibiofibular ligament, along with the interosseous membrane. The interosseous membrane is the thin sheet that connects your tibia and your fibula. So we have our we have our fib, and we have our tibia, and we have a sheet that muscular sheet that runs together to keep those two bones connected, or keep them together. The mechanism of injury for a high ankle sprain is basically just any type of a rotational force, mainly in external rotation. So if we were to externally rotate the foot, rolling it out, we would take everything from our foot, and we're going to take it and we're going to shift it. And when we shift it, we're going to sprain those two ligaments, the anterior inferior tibiofibular ligament and our posterior inferior tibiofibular ligament, along with stretching that interosseous membrane. And the interosseous membrane, when we stretch that, that's due to that when it splits, it's not going to allow that joint to stay in a stable position. All right, along with external rotation causing a syndesmosis sprain, you can also have forced dorsiflexion. So the foot is forced up and then externally rotated, and by doing that, that once again forces the interosseous membrane to be split by the talus. When the talus pushes up, it can come on through and hit the interosseous membrane and cause it to split. Individuals that are at high risk for this is basically any type of sport where it is impact. So obviously we can talk about our football players, our gymnasts, men and women, gymnastics. They are very common individuals to get that after they come off the rings or the bars. Hockey players because they wear skates, and if a skate catches a groove or a skate groove in the ice, and the athlete goes to turn, either rotating when they're skating backwards or forward, if the skate gets caught in that groove and their body weight shifts, now we have our forced dorsiflexion along with external rotation, and there you have a classic sign for a high ankle sprain or syndesmosis sprain. With high ankle sprains, since they are so rare, if an athlete comes in complaining of pain, pain can either be on two sides. Obviously the lateral side for an inversion ankle sprain, or they can also have pain and discoloration on the medial side. So you look at those areas and then you continue to examine a little bit further. But if they were complaining of pain on the lateral side, we check over our anterior talofib, our calcaneal fib, along with our post. When we look at a high ankle sprain, since they are so rare, we don't really see them that often that an athlete comes in with pain. We're going to look at both sides. We're going to look for an inversion ankle sprain, which means we'll have all of our pain on the lateral side on our fib. So I'm going to check my ATF, my anterior talofib, my calcaneal fib, and then I will go with my posterior talofib. So I check those three ligaments, but then I can get in on the medial side and check for an eversion ankle sprain, where I can have some discoloration and pain over the deltoid ligament. So I check those ligaments there, and if the athlete complains of pain in the front, then I can go ahead and continue to move on up and check for, like I said, the anterior inferior talofib and the posterior inferior talofib. Check those ligaments along with the interosseous membrane, and then see where the athlete is. By ruling out certain areas, that's going to take away either the inversion or the eversion ankle sprain, and then it narrows it down to a high ankle sprain. As I was mentioning before, the high ankle sprain is so rare that it's basically only 15% of all ankle sprains are syndesmosis or high ankle sprains. Once we rule out that it is not a inversion ankle sprain for the lateral side or an eversion ankle sprain for the medial side, we can now go in and do two special tests to make sure that we can rule out or definitely define that it is a high ankle sprain. And the first one is just basically the good old squeeze test. And as I move the pant leg up, you're just going to go ahead and squeeze the fib and the tib together, because as I mentioned, we have that interosseous membrane that goes in between the two bones. And if I go ahead and I squeeze, as I'm squeezing, that's going to cause a little bit of pain because the interosseous membrane is now getting pushed together, because the two bones are not in their normal position as to where they should be. So if there's a little bit of movement as I squeeze, as you can see, she's jumping. She doesn't even have one. As I'm jumping up or moving up, she's jumping because I'm pushing that fib and that tibia together and moving that interosseous membrane around. The other test is I come down, I have her sit down, and I'm going to externally rotate the foot along with dorsiflexion. So I'm just taking it and doing this, and basically what I'm doing is I'm jamming that talus up into that interosseous membrane. So as I push up and externally rotate, I have force going up to cause the injury for a high ankle sprain. Another part of the evaluation process is if you suspect a high ankle sprain, you want to go ahead and go in with sending them to an orthopedic to have a x-ray taken on the ankle. I would go with an orthopedic since they are sports medicine as opposed to a family practitioner, just to help rule it out, because if it is a high ankle sprain, then we can go get in with the specialist and start our rehab process right there. On our rehab process, some of the things that we might have is doing our range of motion exercises, along with, if it is severe enough where that interosseous membrane is separated, sometimes the physician will want to go ahead and perform surgery and place a screw through the fibula into the tibia, because that interosseous membrane separates, it's not going to come back together. So we try to come on in and pull it back and keep it in a nice tight position.